Hello, my name is Dr. Mark Lerman, and I am the Medical Director of the Kidney Transplant Program here at Medical City, Dallas. I want to talk to you today about live donor ABO Incompatible Kidney Transplant. Some patients that need kidney transplants have healthy and willing donors that do not have the same or a compatible blood type to donate a kidney directly to them. It's always best to have a donor who is ABO compatible so that under usual circumstances we try to put incompatible pairs into our paired kidney donation program. In rare cases, the pairs are not easily matched in the KPD program. When that happens, we can list you and wait for a compatible donor from the deceased donor kidney list, which sometimes can take years depending on your time on dialysis and blood type, or we can offer an ABO incompatible transplant which can allow your donor to give you their kidney. There are no additional risks to your donor, but you, the recipient, must undergo a series of treatments we call desensitization to prevent severe rejection. Our first slide shows which blood types are compatible between pairs. Blood type O can give a kidney to any blood type of the recipient. Blood type AB can receive any blood type donor. If your blood type A, then your donor must be either A or O. And if your blood type B, your donor must be B or O. The next slide shows the frequency of the blood types in the U.S. population. As you can see, blood type O is the most common, followed by blood type A, then blood type B, and then finally the rarest is blood type AB. This slide shows what could happen if we did not desensitize the recipient against a donor with an incompatible blood type. As you can see, there would be danger of something called hyperacute rejection, which would destroy the kidney immediately. The next slide outlines the history of this type of transplant and desensitization. I want you to spend special attention noticing that after 3 years, there's no difference in the success of an ABO incompatible transplant with a compatible transplant using desensitization. The next slide summarizes the various steps in our ABO incompatible program. First, we place all of our incompatible pairs in the KPD program. Then we measure the recipient's anti-ABO titer against the incompatible donor. We next must get permission from the insurance company to perform desensitization. That's followed by careful informed consent from both the donor and the recipient, and then we begin the desensitization protocol. We closely monitor anti-ABO titers before and after the transplant. Rejection is very unlikely when the anti-ABO titer is less than 8, and after about 3 weeks following the transplant, the titer doesn't seem to make any difference. This video is to educate you about this option only if you do not have a compatible live donor and you are not suitable for our paired program, and waiting for a compatible deceased donor is going to be too long. If you are interested in our living donor ABO incompatible program, one of our coordinators will schedule an appointment with me to discuss any questions you or your potential living but ABO incompatible donor may have.